So let's just jump right in. In our last interview, we talked a lot about the costs and the ramifications of the nation's obesity crisis, but let's zoom in on the Black community. And can you share some of your thoughts on the impact of obesity on the Black community and also some of the reasons that we see this disproportionate impact?
The impact is profound. Obviously, we're in the midst of a pandemic still, and with patients who or individuals who are overweight, which we should include not just obese, their outcomes from coronavirus disease were much more uh, unfortunate in that they were more likely to be on a ventilator, more likely to be in the ICU. And according to the CDC, at one point with hospitalizations, over 30% of patients were obese. And if I could talk about the physiology a little bit, when you are obese, the weight that pushes on your lung cavity prevents your ability to really take a deep breath, and it reduces your ability of air inflow and outflow. And we're dealing with a respiratory disease, and so that put folks at an increased risk. Then you take women who were overweight or obese and pregnant, and those are two doubly conditions that led to immunosuppression. And so why some of these things exist, I heard some of the prior panelists talk about, but what do people say? You need to have a better diet, you need to be active. Well, if you live in an underserved community where there's no grocery store, but there's lots of locations for processed food, if you live in a community where it's not safe because you're worried about, impacts of gun violence in your community, then it's hard to be active walking in the streets to reduce that. And when folks are living in densely populated communities for low wages, it's less expendable income for children to get exercise. It's less expendable income to get fresh groceries and so forth. And it's not in your community. And I know this is a long response, but the final is, if you've ever been in a community with no grocery store and the best grocery store is 2 bus rides away, that's you on a bus with arms full of groceries, just trying to get fresh produce that can last more than a day in your household. It's tough to do. And so those are just a few of the social determinants of health that existed long before the pandemic, but were more profound in the midst of coronavirus disease.
Well, and you bring up so many interesting aspects of this that I want to get to. But first, just
Yes.
staying on the pandemic for a minute. Do you
Yeah.
fear that the pandemic itself worsened the obesity crisis among Black Americans in particular? It looks like still don't have complete data, but we do seem to have some indicators saying that the pandemic worsened an already serious problem.
So I do think that in some instances, people who were already overweight became obese, and that people who were on a borderline of becoming overweight became overweight. I mean, it was a time for all of us in America that if you could shelter in place, you sheltered in place. There wasn't much to do. A lot of people found comfort in food and meals, and when everything else was closed, you could still go to a fast food restaurant. And unfortunately, there are more fast food restaurants than grocery stores. And when you look at the leading causes of death, certainly in Philadelphia, but in America, number one is cardiac disease. So that includes strokes, hypertension, heart failure. Number two is cancer, and many cancers are exacerbated by obesity and being overweight. Number three right now is COVID. We've already talked about your increased likelihood of severe illness and death from coronavirus when you're overweight or obese. And number four is casualties or gun violence. And so all four of those conditions, coupled with being obese, yes, impacted them severely, and especially if you were a Black or brown person.